Hi you guys, I hope this video finds you in good health. I just wanted to jump on here and really quickly talk to you about the current state of affairs as far as coronavirus is concerned, because as more and more unfolds before our eyes, I think the decision of what to feel and how to act and how to behave can be very difficult. And most of us, myself included, are constantly teetering along this line of which of our actions are totally alarmist and which ones are completely inadequate for what's ahead. So as someone with a unique background of being both a healthcare provider and a caregiver at home to someone with immunocompromise, I do feel compelled to share my thoughts on the matter, despite not being an infectious disease or immunology specialist by any means. I personally am just someone from the medical world that wants to speak to you in digestible terms and help you bring some peace and love back in the time of Corona. So let's just very briefly talk about how the virus actually takes hold in your body and what symptoms to expect, and also when to get care. If you imagine the virus looking like a green virus emoji, it's like the green sphere with the spikes all around it. That's essentially what coronavirus looks like. And each of those spikes, if you imagine them as a key that fits into a very specific receptor or a lock on the outer membrane of our cells, that's exactly what happens. And when the virus finds the right receptor, it opens the gateway, allowing the virus to enter the cell, replicate within it, and then burst out of the cell, go and replicate on and in other cells, and that's how it takes root throughout the body. So because respiratory droplets are the main form of spread of the virus, the first place it will tend to take hold is in your throat. So you'll present with a sore throat and cough. You may also have a fever, general aches and pains, and in select few cases, also nausea or diarrhea. Now, these are all totally non-specific symptoms, which means that a whole host of conditions present in the same way. Take the cold or the flu or allergies or gastroenteritis, they all present with similar symptoms. So it can be very hard to track the virus. If you are a normal, generally healthy adult, you want to, at this point in time, if you're presenting with these symptoms, stay rational, do not panic, and take care of yourself at home. You're gonna take over-the-counter pain and fever medication like Tylenol and Advil unless your physicians have told you explicitly not to. Also decongestants to help you loosen up the phlegm and help you dispose of it, and make sure you do dispose of it. Don't leave it lying around for other people to touch, and don't hold it in either. Also, drink electrolytes, hydrate, rest as much as possible. You can set up a humidifier in your room. You can even opt for more natural remedies like echinacea or herbal teas. But my point is to just stay at home, self-isolate, and start caring for yourself slowly but surely while you can without needing external care. Now, this only applies to, like I said, generally healthy adults. If you are a sick child or have a sick child, or if you're above the age of 50 or have existing comorbidities, then you want to go and seek help immediately. Now, the difference here is those in more sensitive states of health are far more likely to develop the more severe symptoms of the virus, whereas most of us, being generally healthy, will never get to that point. So to take the current or eventual burden of disease off of our healthcare systems, we want to do what we can from home and leave the limited resources to those in dire need. But even as a healthy adult, if you do develop any difficulty breathing or a very high fever, then go and seek help immediately. In the meantime, however you want to intuitively care for yourself, do it. Whether that means donning dust masks all the time or wearing gloves or trash bags, whatever it is, do not worry anymore about what people are gonna say, what you might look like, if it's appropriate or not. If it makes you feel better, your peace and your mental health are of the utmost importance during this time. So do whatever makes you feel like you are doing your part to care for yourself. I will say that scientifically and statistically speaking, dust masks are not going to offer you too much protection. But honestly, if you want to wear them, to hell with it, put them on. I will say that if you are going to wear them, keep them away from any dampness or humidity, because that will take away from any protection that they might offer. Also, there are reusable, washable masks. So if you want to wear one regularly, do that and save the N95 masks and the surgical masks to those on the front lines and those in more sensitive states of health, like I mentioned, those who really need them. On the topic of washing your hands, soap and water is the best way to do it, and there's a number of steps that you can follow to make sure that you're being thorough. But on the go, or if you want to double up and also use hand sanitizer, but you're not able to find any, you can make your own very easily at home, mixing 3/4 parts isopropyl alcohol 91% and 1/4 part aloe vera gel, or half 99% isopropyl alcohol and half aloe vera gel. The addition of aloe vera gel is extremely important because it's going to keep you from applying direct alcohol onto your skin, which is not necessary. And also, if you have open wounds or eczema, psoriasis, any amount of alcohol is really going to aggravate your skin, so just be careful there. When you go to stores or shops for food or supplies, I understand the need to want to stockpile everything, but just approach things with an air of conscientiousness for everyone around you. Everyone is going through this together, and if those of us that have access to vehicles or have the means to really bulk buy, take all the goods, then what remains for everyone else? So I would split your purchases between fresh produce and frozen goods or canned goods. They will last longer, they will do just fine for you, and that means that there's enough of the remaining for everyone else. As far as things like toilet paper, paper towel, water bottles, etc., I get that that's important, toilet paper especially, but what I will say is there are certain people around us that require that far more than we do, like children or the elderly, whether it's toilet paper or baby wipes, while most of us can do just fine with bidets and water. I would, however, stock up on a 30-day supply of either Tylenol or Advil, something for fever and pain, as well as a decongestant and maybe some Gatorade or Pedialyte, just in the case that you do need to self-isolate and you need these supplies to take care of yourself. If you are able to or have already collected quite a supply of goods that will last you a good amount of time, please consider sharing them with your neighbors or anyone around you who you know does not have access to them or is unable to find them for whatever reason. We're all in this together. Most of us have never experienced anything like this in our lifetimes, and so it is so important to make sure that we as a community are doing everything we can to band together. Social isolation might seem like a drastic move, but believe me, it's so important, and I think it's the only fact that changed the trajectory of China's cases from concave up to concave down. And if we can do that, albeit we do not have China's infrastructure of being able to build a hospital in 3 days or shut down an entire province, but if each one of us does a little small action, it will add up to a great result, and we can hopefully accomplish much of the same before it gets far too out of hand. As I already mentioned, the demographic most at risk are the elderly above the age of 50 and also those with comorbidities. So if you fit this demographic or if you live with someone within this demographic, then please take extra care to be so cautious around them and take extra care of them. We might not get ill, but if we are asymptomatic carriers of the virus, we can do just as much damage bringing that virus home to our loved ones, and none of us wants to do that. As it stands right now, they're saying there aren't enough tests. I don't know exactly, but if patients aren't already being treated in hallways and stairwells, at least in Canada, they soon might be. And this means that our healthcare system is about to be overwhelmed. Healthcare workers are working well beyond the call of duty and their capacity to rush into burning fires to try and protect patients, putting patient welfare and health above their own, all the while wondering what might happen to them or what might happen if they carry the virus home. And it's not just the healthcare providers, it's also administration staff and delivery personnel and custodians and everyone in this giant ecosystem that is banding together in a time of need to try and do their best to keep us standing. So it's time for us to be a little heroic on our own, do what we can while we can, whether that means isolating ourselves, sharing goods, taking care of our families, or just making sure that we are being smart and rational in this entire process and not acting with any hysteria. I do also just want to take a very brief moment to address the comparison of coronavirus to non-contagious conditions such as homelessness and hunger and obesity and chronic disease. I think it's very important to understand that nobody is trying to compare apples to oranges here. All we're trying to do is put things in perspective. Yes, these are threats that may be far more predictable and less aggressively urgent today, but the fact remains that those in immunocompromised and destitute conditions are amongst those at highest risk of disease, and their ubiquity in society makes them take a back seat to urgency of care, when without that state of living, their risk of all disease would be so far improved. Obesity, for example, is just like smoking in that it causes frail health, and that means an increased susceptibility to all diseases, including coronavirus. All of these situations will make recovery and prognosis that much more strained. Coronavirus is just the latest and greatest in our generation of biohazards. In my lifetime alone, we have seen epidemics and pandemics of cholera, CJD, the plague, dengue fever, yellow fever, SARS, MERS, Zika virus, Ebola, H1N1, and now coronavirus. And this isn't even a complete or extensive list. All of this is to say that COVID-19 is neither the first nor the last communicable disease. I am by no means comparing the impact of any of these in this video because it just doesn't make a difference to anymore. But the point of the matter is more of us will survive than suffer. While we take this vulnerable time day by day, now that we are right at the beginning of the storm, we do have an incredible opportunity to rationally prepare ourselves so that we may persevere through this trial in good health, long enough to get more information or find a more secure way to evade illness and ensure that we are strong in health to avoid catastrophe as we age and become more vulnerable by the time the next biohazard hits. Now, none of this is by any means an attempt to be insensitive to those with intentionally or deliberately immunosuppressed conditions, people undergoing chemotherapy or organ transplant, and it is also not overlooking those with potentially life-threatening acquired immunodeficiency syndrome or human immunodeficiency virus and beyond. In fact, individuals in this fragile state are in the most need of protection and care. So if the rest of us can do our part to keep ourselves safe, calm, and out of harm's way to whatever extent we do have control over, our healthcare services can be better allocated to those in serious need. Just to conclude, I will say that we are all universally alert to this predicament. Some of us are living in countries with far more open access to care and supplies than others, and we take that massively for granted, at least here in Canada. We are all holding on to our seats, bracing for impact, because at least where I am, I really don't think it's hit just yet. And remember, in situations of fight or flight response or stress response, our body releases the stress hormone called cortisol, and cortisol downregulates our immune system and inflammatory response, which leaves us vulnerable to not only this pathogen, but all pathogens. So the best thing we can do is stay calm, eat well, sleep well, exercise if you're able to, and keep your immunity up if you are in a position to. Eat lots of vitamin C, vitamin B6, and vitamin E. These will all help boost your immune system. And wash your hands. Okay, Godspeed, stay healthy. I will talk to you soon.